We have a 1.5 hours here designed for the three of us to share with you some great tools, approaches on leading telehealth optimization, specifically on telehealth. So Sam is right now in Hawaii, getting up very, very early for us. So thank you very much. And Trevor is in Florida. So again, this virtual hybrid conference here is wonderful that we have that. I'm going to kick us off here, and then we're going to have Trevor take a couple sections, and Sam is going to take a couple sections. So you hear from different people here, make this a little bit more animated and interactive. And then we're going to go into a Q&A, and then we'll wrap it up with a few more slides. So if you want to use the Q&A function in the app, so go to our session, go on the Q&A tab and tee up your questions. That will help us to dive deeper, because we're going to cover a lot of topics before we jump into the Q&A session. So good. Trevor and Sam, thanks for being here. We've got about a dozen people in the room, but we also had some refreshments next door. So I think we're still competing a little bit with that. All right. Without further ado, neither Trevor nor Sam nor I have any real or apparent financial relationships that may create a conflict of interest to disclose for the purpose of this presentation. So we're going to start with a poll here. We kind of always like to know who's in the audience so we can tailor it. Is it mostly academic medical centers? Is it mostly others? Is it smaller? So if you could go also in your app to the session and to the poll tab, and the two questions we have teed up for you here. So after you answer the first one, if you advance to the next, is what type of organization do you represent today? And to what extent would you say that telehealth is currently optimized at your organizations? How far along are you in the optimization journey? That gives me an indication, and us an indication, how deep we want to dive into the different topics that we have prepared here for you today. All right, we've got some answers coming in, wonderful. So we've got a great distribution here: academic, health systems, community health center, government, others. So it's going to be a mixed bag. So I'm going to try to cater to the whole breadth of healthcare organizations. So very good. And then to what extent is telehealth currently optimized at your organization? If you could bring up that second question to see how people are responding to that. Okay, telehealth is optimized as needed. Telehealth is routinely optimized, is systematically optimized, not actively optimized. Okay, so most people rank themselves in the middle. Let's do a little bit more math here. So we've got can you still keep that up? We've got about a third in the top two categories. I saw 30% adding that up. And good. Well, I guess we'll move on here. Good. So we're going to be talking about, just briefly, about the benefits of optimized telehealth and the cycle of optimization. And then really the meat of the presentation today is about the telehealth success framework and the various different tools that you can apply in your organizations to optimize telehealth, the various aspects of workflows and policies and project management that you can consider as you're looking to optimize telehealth at your organization. One of the models to use in continuous improvement is the DMAIC cycle, coming out of Lean Six Sigma. And you start with defining the problem. Well, we want to optimize telehealth. We want to improve physician engagement. We want to have patient satisfaction increased. We want to know simply whether we're doing good on telehealth or not. And so you define the problem, and then you measure and quantify the issue. You analyze to find any root causes of the deviation of a standard that you want to go to. Then you improve it, and then you go to, again, you control it, and you see any deviation. So a standard tool that you can apply. This was not the core here of the presentation, but this is what kind of is the framework that you can refer back to as you're looking at the various things. The optimization methodology that basically kind of implements what I just showed in this DMAIC model is that you do a current state assessment. Where are we at with telehealth? Where are the gaps here, or where do we want to go next? And you should do gap analysis, and then you take a look at the different problems. Do we need to replace our technology? Do we need to look at training on virtual exams? If you were in the last session, Dr. Matt Feynman shared with us some really great tips how to do virtual exams. So do we need to train our clinicians? So what are the areas where we want to optimize telehealth? And then how do we manage the stakeholders? And then do the design of the solution, of the training, of the technology replacement, and then the change management of implementing that solution, and then wrapping it up with accountability, keeping a score of the metrics. So that's basically the general methodology that you can use to optimize telehealth. And what we're going to dive in here deeper is the different tools that you can use. Obviously, the value of optimized telehealth is that it provides a great experience for patients and clinicians alike. And that's, I think, is always very important. We always look at the quadruple aim of healthcare improvement, so that we have high patient satisfaction and high clinician and staff satisfaction. So really looking at optimizing telehealth for the experience, because a well-trained, a well-educated clinician on how to do telehealth well will create a much better experience and much better health outcomes also for patients than if it's not optimized. It provides a clinical viable alternative to in-person care, but if it's not optimized, then people will not use it as often. It helps you to effectively compete against what I just call the telecompetition, the Amwells or the health systems that are doing it, or other competitors, or the insurers that are offering their own telemedicine solution. Reducing no-shows, improving chronic care management outcomes, increasing volume, geographic reach, so looking at the revenue and financial side, expanding service offerings, and there's a multitude of reasons why you would want to optimize telehealth. And it's important that you understand and that you become conscious about why do you want to optimize telehealth. Obviously, you're here at a telehealth conference, so you want to learn about what to do telehealth, what others are doing, but it always starts at the top with what is the executive, what's the leadership motivation for investing into telehealth and telemedicine. The success framework that we've built over the years and working with telehealth. I started working on telehealth at the Mayo Clinic in 2003 and was fascinated by the ability to use technology to deliver care at a distance with remote monitoring tools, and then later on with video visits. So really the way we framed it up is that first off, one paradigm to look at is that there's the launch of new services and then the running of the services. Then there's the optimization and the growth. And it's really in four different areas. The first area of telehealth optimization is about leadership and strategy. The second one about rules and regulations, design and support, and adoption and sustainability. And so we're going to dive in deeper into our sections here, talking about various aspects of these four different pillars. So we'll talk about leadership and governance and strategy. We'll talk about rules and regulations. We'll talk about workflow design, and always in the context of how can you optimize, kind of what does an optimized state look like, what would an unoptimized state look like, and what is it costing you. So that's the pattern we'll be using. And so we look at workflow design and technology selection, support, and then we'll wrap it up here with change management, performance management, and project management as well. And then we'll open up for Q&A. So that's kind of our roadmap here of the various aspects, because telehealth is healthcare. Telehealth delivery is care delivery at a distance. And so, as I always like to say, it takes a village. It takes the nurses and the schedulers and the billing people and the IT people and the policy people and the marketing people. Everybody needs to be involved in making telehealth work. It's a parallel care delivery system. And so that's why you see a lot of the elements that you care about in your traditional care environment also in a telehealth environment. And so for optimization specifically, we look at first focusing out that there is a virtual care strategy, that there's leadership and governance support, and that there's workflows and policies that have been defined. We look at that we have the right technology that serves the patients and the clinicians well. A lot of people got started maybe with Zoom. A lot of people are now switching over to the EHR, or maybe they're finding that the EHR telemedicine solution is not really creating the great user experience. We look at performance management as well as clinician engagement, which is very key. And then ultimately at marketing, letting the clients, letting the patients know that this is available. And so we'll be talking about all these different aspects here in the next slides. But so that we know where we should spend a little bit more time on, we have teed up another poll here. So if you could answer this third question, with which aspects of these of telehealth optimization are you most interested in? And I think we had a select all, you can, all that apply. So multiple choice here, telehealth optimization process and tools, okay. That's coming up here. Whatever else we're saying, some strategy, operational support, workflows, other options, okay. So I don't remember, because I haven't seen that on the other slide. Is there a free from text field, Kathy, that people could type in? Otherwise, if people can put it in the Q&A, or if somebody in the room said other options, can you shout it out what you were interested in? Okay, maybe the 29% came from from the that, or is it maybe just because there were so many options that they were? Oh, there's no option called other option. It's just the way that this answer is presented, because only 7 answers fit on one slide. Okay, we learned something more about how to use these Q&A tools. So do not have more than 7 answers. All right, good. Okay, so I think the primary option here was processes and optimization tools, and so we have a lot of these in here, with especially in the latter part of the presentation. So, but that also means that we can maybe move a little bit faster on the initial sections, which is why we asked that question. All right, so we'll dive in here into the first pillar, which is strategy and executive leadership and governance. And telehealth optimizations, first and foremost, starts at the top. Telehealth success starts with the CEO, starts with the executive leader, with the executive leadership team making the decision that we are committed to doing telehealth, and we are committed to doing telehealth well. That's the first starting point. If you're a grassroots effort, somebody asked a question in another session, said, yeah, we want to do telehealth and oncology, and my answer was, well, you got to sell it to the CEO first. That's the starting point, because without that, it will not be sustainable. Before COVID, yes, maybe you could have a little bit of a skunk works, I think it's what it's called, right? And so just some project on the side and you could just demonstrate it. But these days are gone. Telehealth is now prime time, and the CEOs need to, and leaders need to realize that. So it starts really at the top. It requires clinician leadership. I want to just emphasize this over and over again. Telehealth is a clinical tool. Just like they decide whether you get an MRI or a CT scan, they get to decide and get to wield that as a tool of whether to deliver care in person or at a distance. And so really telehealth is a clinical tool and requires clinician leadership and engagement at every step in the workflows, in the technology selection, in the marketing, in the training, in all aspects. We need to have clinical leadership and clinical input. It's very key that this is not managed as a technology or an operational project in itself, and it involves the whole organization, a whole village. We need resources, we need accountability. And so from that perspective, and Dr. Matt Fehme in the last session mentioned that as well, we need governance. You need to have some governance involved in making sure that you manage your telehealth program well, and that you have representation from all these different areas that need to assist you in the prioritization and resources and accountability, so that you can optimize. Because optimization will take time and will take resources. And so again, you need to have made those available by the leadership. The governance team here, if you don't have one, or if you're looking for aligning the responsibilities, the telehealth steering teams that we've established and that we're facilitating, we always start every meeting with those kind of 3 bullet points or customized to the organization. It's about steering the expansion, growth, and optimization or continuous improvement of all telehealth. It's allocate resources and remove obstacles, so a typical leadership role, and then provide accountability, another leadership role. So that's what the telehealth governance team does. If you're a smaller organization, just add it to your executive agenda once a month or every 6 weeks, and just take a look at what do we need to do about telehealth and telemedicine, and have somebody from the organization report. So it doesn't have to be its own separate team, but it's got to have that cross-representation and can be added to existing meetings that you already have. So when there's a lack of executive buy-in, so this is the pattern that I was referencing earlier that we're going to be using in all the sections here. So in the first column, we're going to start with what is a typical or what could be a possible common current state. What is the cost of that current state? And then what are the tactics that you can use? So again, a lot of this material we're sharing here today, we want you to download the PDF, file it away, and then reference it if and when you need it. If you have a lack of executive buy-in, then telehealth adoption is slow, and you may be losing patients. And then education and engaged leadership is what is important. You may be losing patients because of the competition and because patients are driving towards convenience. If there's a lack of governance, then there's a lack of support staff, lack of resources to improve. And if there's a lack of clinic leadership, then clinicians are not engaged. They may be resistant, recruitment may be harder. So the goal here is to identify a clinical champion, somebody who is passionate about telehealth, telemedicine, who sees it as a future of their professional career for the next 20, 30 years of how they will be practicing medicine. And so basically, that's the kind of takeaway from this section. The next part here is why is telehealth strategy. So now you've got leadership buy-in, you've got a governance team, so we recommend that you put together a strategy. And it can be a one-page strategy, it doesn't have to be a 17-page document, doesn't have to take 6 months to develop. You don't even have to harm any consultants in the process, because you can just go and do it yourself. But you want to use it and you want to define it so that you raise awareness across the organization that, yes, we are now committed to doing telehealth, and here's why. That you provide clarity as like, why is it important to us, and what are we actually focusing on? We're focusing on expanding our geographic reach, we're focusing on growing, we're focusing on offering a convenient access to our care, we want to serve our population better. Whatever your motivations and reasons are, you want to clarify in your telehealth strategy. Then that builds and creating the desire. You want to establish focus. What are we focusing on in 2022? What are we focusing on in 2023? Where do you want to put our attention to? That gives you then the ability to prioritize projects, and then also then you can allocate resources to it. So these are the reasons why you want to develop a telehealth strategy. There are 6 elements to a good strategy. You have a vision of what telehealth could look like for your organization. You have strategic alignment, and I have an example on that, meaning how does telehealth help us to achieve our overall strategic plan that we have already in place. It helps to identify what are our objectives here, and then what is our sustainability model? And it's not just financial sustainability. A lot of organizations we work with are community health centers, and it's still up in the air whether the exception that community health centers are experiencing of being able to serve their patients at home, whether that'll stay in place. But what is the sustainability model? Maybe we can focus on our ACOs projects that we've been engaged in, maybe focused on coronary care management. So there's other things to look at. But there's also the organizational sustainability of how can we keep people motivated and make it enjoyable and make it a good way to deliver care. That's also sustainability. Then having a marketing plan to let patients know that this now exists, and then ultimately have a roadmap of what you want to do in the next kind of 18 months of where you want to invest in new services or optimization projects or just creating governance team. And I have an example of that here after the Q&A later on. Strategic alignment, most of you are familiar with the 6 pillars of that organizations have in the strategic plan, and I'm just going to bring them up quickly here. So there's always, the question that's being answered here is, how does telehealth help us to improve our quality objectives, or how does it help us to improve our service objectives or people? Like if our goal is we want to attract and retain a highly competitive workforce, then telehealth may help in that, because an educated workforce will know that digital health is the future of care delivery, and they want to work with an organization that is committed to and invested in doing and offering and training on digital health and telehealth. And so that's one aspect here. And then finance, increasing revenue. So we have found, when we have reviewed 38 different objectives of strategic plans, that telehealth can move the needle into the right direction in about 90% of those objectives. Telehealth is really a great tactical tool to help you achieve what you already have set forth to achieve in your organization. And that's why it's so important to have a telehealth strategy to connect the dots for people, that we're not just doing this because telehealth is now available during COVID, but because it's what helps us to achieve, to stay in business, to grow, to be a better quality organization. So little recipe here, and a gap analysis. Contact us if you want that tool here. But it's basically some 10 questions about how, if you have a telehealth strategy, it's a simple 10-question questionnaire that you can ask yourself to see how you're doing based on what we have discovered in organizations that they are doing, and that's working well, where it helps them to guide. All right, with that, I'm going to switch over here for the first time to my colleague Trevor in Florida. So if we can have the friendly tech support staff here, wonderful, beautiful transition. So Trevor, you're live and on camera, and I will advance the slides to you to talk about rules and regulations.
Great, and thank you, Christian. And thank you for all who are attending in person. It looks like we have a great virtual participation as well. As Christian mentioned, I'm going to be speaking on rules and regulations. So to begin this presentation, we wanted to start with a funny quote. Policies and procedures, they're like Monopoly. Procedures move us forward and policies keep us out of jail. All joking aside, regulations, rules, policies, procedures are incredibly important to the telehealth optimization process. On the next slide, we'll be viewing the 6 key telehealth policies, starting with website manners. This is a term that you might have heard throughout the week at the conference, but basically the website manners are important for creating an environment. We want the clinician to feel secure with a clean background, a welcoming environment, and we also want the patient to feel welcome during the meeting. We want them to notice that this is a tradition, or that this is a clinician visit that is similar to an in-person visit. We want that patient to feel secure in sharing information. And by creating that welcoming environment by the clinician, the patient can feel as if they're actually on site talking to a person in a live situation. Next is patient safety policies. These are incredibly important. We want patients to feel safe while using this technology. We want all of their information to feel secure. We want this environment to feel as if it's private, only between a few individuals, and that they feel secured providing sensitive patient health information. The next one would be informed consent. Informed consent, incredibly important. We want patients to understand what they're getting themselves into with telehealth. This is different state by state, but it's always important to treat these virtual situations just as you would as an in-person visit. The next being physician licensure. Very similar, incredibly different state by state. We want to ensure that organizations have the current up-to-date policies surrounding physicians' licensure based on their current state that they are working out of. And that can be different from state to state. Some regions typically adopt similar physician licensure practices, but it's always good to double check with your state policies before implementing telehealth. Next being clinical guidelines. We want clinicians to feel safe providing telehealth to certain patient populations. There needs to be standards and expectations for these physicians to provide care. And really, it really comes down to determining whether telehealth is the best fit for certain patient populations. And then finally, billing and copays. We all want to get paid for the services that we render. People oftentimes do not bill telehealth in the proper way. So having the proper EM codes and working with your finance department is crucial when developing those billing procedures. A few additional things to consider: state and federal laws, including Medicare and Medicaid, licensures, which we've just spoken about, and informed consent, HIPAA compliancy, all incredibly important to understand. Especially HIPAA compliancy, we want our patients to feel as if they are providing useful information that is being private between the clinician and that patient, and is being properly stored. So having regulations and rules that center around HIPAA compliancy is incredibly crucial. Also, risk management. We want organizations to feel as if they can identify emerging risks with their current organization standards. So understanding risks that might be associated with quality, patient safety, billing and copays is really important for organizations to have set policies on how they mitigate risks moving forward. Thank you, Christian. On this next slide, as Christian mentioned, we can kind of talk through what the current state looks like, what that cost looks like, and tactics on how to improve that. And I don't want to read from these slides directly, so feel free to download the presentation and review some of these tactics that we talk about. But the first one being HIPAA compliancy. This can really result in an inadvertent disclosure of patient health information, which we all know is an incredibly unfortunate thing that occurs quite often. We do not want any breaches. And that being said, executive leadership really needs to take that seriously and define those clear expectations and policies centered around patient privacy. Next being reimbursement. Again, like I mentioned, we all want to be paid properly. And if you are not using the proper E&M codes for telehealth, you can have poor reimbursement returns. We are obviously seeing some more flexibilities come through the federal government and other state entities, but we want to make sure that you are being properly compensated for the work that is being done. So in order to do that, we need to define reimbursement standards, make sure that financials and operations are working together to clearly identify the clinical tools being utilized, as well as the proper codes, whether that be HCPCS, CPT codes, that are really going into this. Same thing with data collection. We have a lot of organizations who might not be collecting information properly. It might be stored on an Excel sheet with no protection on that being. So really creating standard practices, using REDCap, using password protected applications can be very important to an organization's security and compliance. So properly training your employees on how to utilize those tools can really help benefit with designing programs and using metrics to really guide operational efficiencies moving forward. And then finally, just quickly, no risk governance existing. So there's low risk tolerance for the organization. They're not able to identify emerging risks and really mitigate those once they come up. So really creating a governance structure and a review structure that can identify emerging risks. And especially when it comes to quality and patient safety, we want those to be identified, have leadership know, and have management and clinical staff be able to set plans and workflows to develop solutions to those emerging risks.
Thank you very much, Trevor, and we'll have Sam talk about next here, but I want to also highlight, obviously you have all of these policies already in place for your in-person visits, and so really the exercise here is to think about, well, what is different in the telehealth environment, right? What are the implications of now patients being maybe in an environment where they can be overheard, right? or where the physician can be overheard. So telehealth changes some of the environments that are not outside of our control. So very good. So we have also some resources here in our slides. These are linked in a PDF that should work. So if you want to research guidance on different policies from a CCHP here or CMS, all of these are linked to the various different policy and resource pages, so that you can stay kind of on top of what they're publishing here on telehealth regulations and rules and regulations. Our next section then here is about the design and support, workflow design and launch support. And so I'm now happy to hand it off to Sam and for her to talk about for us about the design of workflows, which is one of her passion topics as well. So thank you, Sam.
Great. All right. So when we think about telehealth workflows, we really want to think about it in a lot of different areas. So just like you would have your in-person clinic, we're thinking about the scheduling portion, onboarding, rooming, post-visit, follow-up, and billing. So when we think about it, again, just come back to what is your in-person clinic? What are all those components you need? And of course, we need to think about those in our telehealth components. So if we think about optimization, again, going back to the dynamic model, we have a measure, analyze, implement, and control. And so when we measure, what we're looking at is what's our current workflow. And what we want to do is make sure we've documented our current workflow. Then we're going to look at that and analyze it and say, is this working? Is it working for our clinicians? Is it working for our patients? Is it working for the front desk? You really want to understand how it's working. And that's why those things like clinic champions, physician champions, they're so important because they'll be able to communicate what is and isn't working. From there, we can have an optimized workflow design. Then we absolutely want to train everybody. And I think that's something we've really seen in the last 2 years, that clinicians and staff have really been asking for more training. What is this? How does this actually work? Are we really putting these through a full scenario that we understand how they work? And then from there, you're going to optimize and you're going to take that workflow and adjust as needed, because you always want to be having that continual optimization. So now in the same idea, if we think about what's our current common state, and this is really what we're talking about, is this idea of what happened when the pandemic started and everyone turned on telehealth, right? That cost of that current state, and then our tactics to get out of it. So again, a lot of workflows we see are not standardized. It's like this clinic's doing it this way, this clinician's doing it this other way. And what that happens, it just makes it inefficient. It makes people frustrated. And it also makes clinicians and patients avoid telehealth because there's no standard to it. You're not sure if that person offers it. Does this other person give me the same thing? And so your tactic is what we talked about in that slide before, is really documenting that workflow design and then having a hybrid model workflow redesign. So when I say hybrid model, I think what's really important to remember is that when the pandemic started, a lot of in-person was stopped. So it was a bit easier to have a telehealth workflow because you had a virtual workflow only. Now that practices have been open, some as long as, a year, 18 months, we have a hybrid model, but we don't really have a hybrid workflow where we have in-person and virtual potentially happening on the same day with clinicians. So that's something you really want to look at. And then of course, documenting your IT support model, that's also very important, because what we find oftentimes is what we think is our support model doesn't actually match when we start looking deep into it. The next component, training, training on that workflow. Again, people without training, people are just honestly just waiting to go back to normal, meaning when will I never have to do telehealth? And we find that on both patient and clinician side. So that's where that training, really training on website manners. It sounds like in the conference, you had your, Let's see here. It sounded like in the conference, you actually had your website manager training was done. And so that's something that is super important there. Sorry, 1 second here. Okay, and sorry about that. Just having been asked to pin my document, and now the slides are very small. Okay, so we can go on to the next slide.
I think, Sam, you had one more row around telehealth in-person workflows not in sync, right? Again, with the hybrid that you mentioned.
Yeah, I see myself, so I'm just gonna have to ask technically here, and this would just be like if we're to telehealth, you're all seeing me on the screen correctly, right? Because I see myself on the screen correctly, and I see my slide as I have my system set up right now. Is that what everyone is seeing?
Yeah, we're seeing the slide big,
Okay.
and then you in the corner, so.
Great, then I'm gonna leave that. Okay, perfect. All right, sorry about that. So in person, that's one challenge. When you're telehealth in person and your workflows are not synced up, that's where you have that disruption of in-person care, meaning you can feel really disconnected. Like, what just happened to me now? I actually saw something in the chat feature, so I changed my views on the screen, and that sort of threw me off, which made this feel a little awkward. So that's exactly the same kind of things. And I think that's what's so important about that integration, that you've practice, you really understand what you're seeing, and you're able to connect on a deeper level with your patients. And just like me saying, hey, something strange is happening here, that's okay. That's part of this process. That's how we help be connected and be like real humans. Next slide.
All right, and now we're moving on. Thank you, Sam. Nicely recovered and greatly demonstrated what it takes to do that. So again, and that's the environment, right? And we are all human, and that's we gotta admit to be human. Oftentimes, physicians and don't want to offend anybody, but if you're in the exam room, right, they're on top, they're on point, and it's all just very, very professional. But in this new environment, things are going to happen that are going to be interesting, and that's where we need some training, and we need to give also then sometimes permission to acknowledge some of the challenges that we are experiencing. So speaking about technology, how do you select actually the optimized technology? So as I mentioned before, telehealth is a clinical tool. It's not about the technology. It is not about the workflows. All of that needs to be defined, but ultimately it's a clinical tool. And with that, you want to reuse the right tool for the right purpose, right? So why would you use a bone saw if you need a scalpel? So why do you need one-size-fits-all telehealth solution, for example? Behavioral health visits, which are conversation only, require a different type of technology than school-based telemedicine with exam tools and an otoscope. Require a different tool than a teletriage admit at the nursing home, and again another tool for a telestroke assessment in an emergency room with a neurologist, right? Just as we have so many different diverse telemedicine healthcare services and healthcare specialties, we need to look at what is the right technology that fits it. And so that's always, and it might be that one vendor is offering a whole spectrum of chronic care management and in-person visits and all of that, but it's also okay to ask for the right tool because no surgeon would be satisfied conducting a whole surgery just with a bone saw. And no patients would want that. So telehealth is not about the technology, well, except when it does not work or is difficult to use, as Sam was just the victim of. And I think I caused it. I think the process issue was as I advanced the slides, the tech guys thought, okay, we're moving on, and so and suddenly things got scrambled, and then we had to recover. What I'm always saying is don't put the horse behind the cart. And you may have picked up on, I'm originally from around here, I'm from Germany. And so, yes, I may be mixing up your metaphors here. And I know it's the other way around, but it's don't buy the horse first, which is settling on the technology, and then figure out which cart you want to push, because it's much easier to pull a cart. And so you got to really figure out first, what is the cart that you want to pull? before you select the technology. So really it's about figuring out first, what is the workflow that we want to use? I mean, what is the technology we want to use? And I just listed 4 or 5 different use cases, right? So behavioral health to the patients at home is different than behavioral health from site to site. Is there an exam involved? Is it chronic care management? Is it remote patient monitoring? All these things are telehealth, delivering care at a distance, but they all require different technologies. And so what we urge organizations to do first is to define your workflows, define your use cases, identify your stakeholders. And that's not just for telehealth, that's for anything. One organization we're working with is looking at some better patient engagement tools. The contract is coming up. And so being able to sit down and say, well, what messages do we want to send and how often do we want to send them? And does finance want to send messages? And does the front office want to send messages? So really becoming clear about what you as a technology user want before you go out and look for vendor solutions. Oftentimes we just see some vendor demos, see some cool features like the salesperson and then buy it. And so a much better process is to actually define the requirements first, to define the cart first before you buy the horse. So the technology selection process then, and actually this model here was taken directly from the Matrix website. There's a telehealth there's a technology selection toolkit out there that was developed a few years back and has been updated recently. And so you can go there and go through the whole process, but ultimately it's what I just talked about. You define your use cases, you identify your user needs, you look at the technical specifications. IT will have some requirements with regards to integration with technology and other things. You also want to look at your vendor characteristics, right? So you want to look at, as the luncheon speaker yesterday pointed out, have they just started out, or do they have reference clients, right? You want to do your due diligence. And so those are the 3 buckets that you want to look at for your requirements. Then you want to go and you want to evaluate vendors. Ideally, you want to do a small proof of concept so that you can validate that this is the right solution, and you do it in a small environment. And then you want to select the vendor. So that's a standard, good, mature process for how you can optimize your telehealth technology. There's one of the other best practices is that you just establish and document your standard. What is the hardware that you want to use? What is the RPM hardware that you want to use? What are the visit softwares that you want to use for the different use cases? In one organization we worked with, we identified that, okay, if a physician is in a cubicle, here's the technology setup with a headset. If it's in an exam room, here's a different setup. If it's directly to the patient at home, or the physician is doing for home, here's their setup. It's different for primary care than it is for behavioral health. And so there's variations in what is the best technology for each and every clinician, for each and every use case. And you want to do that. And then just a personal note here that I've been harping on is that your EHR, while your IT people may love going with the same vendor and just adding the new functionality, you really want to bring in your clinicians and your patients and take a close look at what the experience is like. So, I mean, it's like getting a stool or a chair that wobbles that the clinicians need to use every day, because this is a clinical tool, as I mentioned. And so really getting clinician input. And your EHR solution may serve you well and may be the right solution. But don't just assume, since the IT department said, well, our EHR vendor is now offering telehealth and they have done a lot, that is the best solution. Go into it with open eyes and make an actual conscious decision. So who do you want to please, your clinicians or your IT department? So again, our table here, if there's no technology standard, then you have inconsistent performance. You have a wild growth of different hardware and software solutions. If you have a kind of backwards vendor selection process, you may not end up with the optimized solution. And there's, as you may have encountered here on the exhibitor floor, there's really, really great solutions out there. There are point solutions. They're optimized for telehealth and telemedicine. Some of them, we didn't have any here, are optimized for behavioral health. Some are optimized for doing remote virtual exams. And so really trying to find the right tool that is available, because otherwise you end up with frustration, or people will just make it work. and then it's not optimized. And if you're not doing a proof of concept validation before you really buy 50 licenses, then you may end up with something that you will have a lot of hard time rolling out, and you may save some money up front, so to speak, by going with an established vendor, but it can cost you in the end with the physician buy-in. So technology is important to look at, especially if physicians and patients have reported that they're frustrated with the technology. So in addition then to technology selection, we also need to provide support for telehealth. And there's two areas of support. There's operational support, or actually four. There's operational support, there's technical support, and then there's optimization support, and there's launch support. So operational support, collecting ongoing statistics, training new people, collecting some issues and resolving them. That's the ongoing operational support that most organizations have in a telehealth coordinator. Technical support, that's when technical issues come up, resolving them, configuring the systems, replacing hardware, and optimizing software. Optimization support, that would be a project manager that manages the various projects that you have identified in that gap analysis to identify, well, what are the things that we need to improve on. And then launch support is project management on how do you launch a new service. Let's say you want to get involved with chronic care management or remote patient monitoring for readmission prevention. What does it look like? How do we do the workflow design? How do we all the different steps? And so these four support areas can be handled by one person, or they can be handled by multiple persons. These don't have to be full-time FTEs. These can be part-time assignments. When I started out, we were doing 800 telehealth visits 10 years ago across 10 different sites, across 8 different specialties. So 800 was not a lot in the context of COVID these days, but that felt really big. And it was all supported by half an FTE who had also some technical background. And so I was doing the operational technical support, optimization, and launch support. So it doesn't have to be a huge investment. But in this transition period that we're in, you want to have somebody who is designated as a telehealth coordinator, as a director of telehealth, or even as a medical director of telehealth, depending on the size of your organization. And so operational support is about training and performance monitoring. Technical support is about infrastructure updates. Optimization is about continuous improvement. And launch support is about making sure that you're investing your resources into the right areas. And without operational, technical, and optimization and launch support, you kind of end up with all these costs that we've laid out here in these tables. And obviously the solution is to designate a person and train them adequately by maybe sending them to a conference like this or network with other telehealth coordinators, and so that you have a telehealth coordinator, tech liaison, and individuals in your organizations that can optimize and manage the launch of new services. So another area to look at, do you have adequate telehealth support, and how can you optimize it? All right, so now we're in the fourth pillar and the last pillar of that transformation model. Here, we're going to talk about change management, going to talk about marketing. I think I have it animated here, and marketing, and then we're going to talk about performance management, and then wrap it up with optimization project management before we go into the Q&A. I just love this model. It has served me so well. The ADCAR model for successful sustainable change. I could talk about this all day long, and I see it everywhere. And there was a presentation yesterday afternoon by the CEO of a health system who's doing data-driven management, and he basically used it in a different way. What I love about, and all that we do here is about managing change. We're getting to motivate people to do things in a different way, and especially in this case, clinicians. And so you need to have 5 ingredients in place to achieve successful change. One is you need to raise the awareness why this change is needed. Why are we doing telehealth? You need to create the desire. Then you need to supply the knowledge and train on creating the ability to do this well. So website manners training, training on technology, training on workflow, training on the policies. And then you need to provide reinforcement or accountability to make sure that people are not backsliding. So measuring how many visits are you doing via video, how many telephonic. Well, telephonic reimbursement is going away, so we got to switch over to video. So those are kind of the things. And when you have those 5 areas in place, then you end up with change. What I love about this model, it explains why there is, why change is not working. Because if you take away awareness, if people are not really aware, so if you don't have a strategy, if you don't have a vision, if your CEO did not communicate why we're doing telehealth, then there's confusion. If you don't create the desire, if you don't instill the desire in people to do telehealth because they are not aware of the competitive environment, Dr. Worth, the CEO of a health system, yesterday shared, said, until I did the competitive analysis, I didn't realize how much telehealth competition is actually out there that's going to jeopardize our long-term survivability. So if there's no desire to change, then there'll be resistance. Well, we have so much going on, we don't need to add another thing, and I thought telehealth was just for COVID. If there's no knowledge, then people are reluctant. Well, I don't really know, I don't know how to use it, and I don't want to look stupid on camera, so, and goes along with ability as well. People are frustrated if they can't get any help, if a button doesn't work, if they have to jump through a lot of hoops. And then if there's no reinforcement, then there's backsliding. So if you're rolling out any change in your organization and you're experiencing any of these change management barriers here of confusion or resistance or reluctance, look back to this chart and just look at what you may have missed. Maybe you missed a critical training, maybe you missed creating an explanation for this. Another model that is helpful to use comes from the book Switch by Chip and Dan Heath, and it's about appealing to the logic, to the emotions, and then creating the system. And so this is, you want to find the bright spots. You want to find where telehealth is working in your organization or in other organizations. You want to script the critical moves. What is the process? Which is why we had a section here on workflow optimization. And you want to point to the direction where we're going, the vision, which is why you need to have a telehealth strategy. Then you want to find the feeling, shrink the change, and grow your people. Growing your people, again, to the point that Sam made. You want to train your clinicians on website manners. You want to train them on how to do a remote exam. You want to train your front office support staff or your MAs on how to set up the patient powerfully so that they can be well presented on camera. And you want to start small with small changes and having the end in mind. And then you want to tweak the environment. You want to create workflows, you want to create operational support, and you want to promote. These words were taken from the book I think 15 years ago is when I put the slide together after reading the book. And they apply to telehealth nowadays as they've done. And everything that you've seen kind of in this success framework actually originates back with the end in mind of managing the organizational change. How can we make it easier for us as leaders to optimize telehealth and get people to do things in a different way? And so using these models here like Switch or and tracking back of what do we need to do differently is really the secret to success of really integrating telehealth powerfully in your organization. And so, again, our table here, no organizational change management, there's confusion, resistance. If you don't provide accountability, if you don't measure, which we go to performance management next here, and then you're backsliding, reverting to the old ways. So if you have no way of measuring, some leaders are very excited about kicking things off. They just want to launch things, and then they hope that it'll work. So no, you got to check in with the people. You got to identify, well, how you actually measure that the change occurred and that it is sticking. So that's for some people maybe not so exciting the part, but it's what's needed here. So accountability is very, very key to sustainable change management. All right, and then with that, we'll have Sam talk about marketing here.
All right, so if we think about marketing, I think about it in 3 different areas. We, of course, have our external marketing. That's to our patients. That's website information, online scheduling, digital resources for patients. But we also have internal marketing, which goes a lot with Christian just talked about change management. It's our clinicians offering telehealth to patients, because if we think about who are patients most likely going to accept doing telehealth from, it's from those clinicians. Have we also shared with the clinicians and staff the virtual care services. Are they really knowledgeable about them? Do they know what that looks like? So marketing is not only our external, hey, we're doing telehealth, but again, that internal, now you could also call it communications, but really making sure that everyone on board knows what we're doing and what our goals are. And then the third piece is advocacy. And that I think is important in telehealth because we still need to work on policy, legislation, reimbursement. How do we expand these rules? So these three different components of marketing that really are the messaging. We do this. This is important to us. Let's keep going. Next slide. So if we think about our table and these three components, what I'm seeing a lot now in our current state is that we can have a common current state of patients aren't really comfortable with virtual health or the technology, which means they're resistant or reluctant. Some feel like it's not as good as in person or it's not as professional. And so some of the tactics we use to tackle that would be digital literacy tools for patients. And those can be lots of different things. That could be multilingual instruction sheets. That can be a little informational video on your website, but things like that really let patients know it's happening. You also really, we have a component we use, tech checks. I think this is an important part. And although you might not think of it as marketing, it's that idea of how do I make sure my patients know how to connect with this technology, know what to expect for the appointment before the appointment ever starts. And so by having that process, although it can feel very high touch and resource, you're using a lot of resources, it's an important part to make your patients comfortable with that. Reimbursement, that goes into that advocacy bucket. And that actually has two components when you think about marketing. One is that if our clinicians don't think they properly get paid for this, they're not going to do a lot of it. And at the same time, if we're not really offering it, we have competitors in the market who are offering virtual care and who are completely virtual first. So you really want to understand a tactic for your reimbursement. If you're not clear about what you're doing, you can audit what's going on, communicate with that staff, and then continue to monitor the regulations. And then on that internal, our clinicians, what we see a lot is just inconsistent. These two clinicians offer telehealth, but these other two don't. Well, that causes a lot of confusion amongst everyone of who's doing this, when are they doing it, how are they doing it, and then we're not providing a consistent experience to our patients. So tactics on that internal marketing is really that scripting and workflow process, having that really clarified, trained, communicated, and then a requirement that everyone participate in telehealth. That's how you offer your patients consistent services and allow your staff to really take that and run with it.
Great. Thank you so very much. That was on the marketing piece and also tying it again back to the change management. And I love especially that aspect on advocacy. And a lot of in our state meetings, I think we've talked about that the PHE still is extended until July. And then I think some regulations are going to be extended for another 151 days, I think is what I heard, right? But then the uncertainty is very, very clear. And even the long-term funding of like the Telehealth Resource Center. So there's a lot of uncertainty. So we really got to do, every healthcare organization's got to get involved in being involved in support of policy and writing letters or getting your politicians that represent you in your state legislation as well as in the federal legislation to be involved. Good. We've got two more topics here before we go to the Q&A. And so Peter Drucker, everybody's heard this quote, you can't manage what you don't measure. So to the point of accountability early on, it's very, very important that you identify some key performance indicators. Again, this doesn't have to be complicated. It doesn't have to be rocket science. You don't have to buy a BI tool, business intelligence tool, before you can do this measurement. Just simply measuring the volume or the modalities of telehealth can be an eye-opener. I was working with an organization doing some advisor work, and then at some point she said, well, I actually don't know how many of our visits are telephonic and versus in video, but let me just pull this up. I'm curious. And so she just worked for 3 minutes, and she pulls it up and she said, whoa, 3% of our visits are video, the rest is telephonic. And it's like, that was not the impression that she had. They were talking about 50-50 or 70-30, right? Nobody ever had looked at the data. Nobody ever had asked the question from leadership perspective as to whether it is good. Now, it was still reimbursable at that time, so that was financially, nobody was catching it. But as I think as we've discussed here, and as I've discussed with clinician, whether telephonic is really good care. It can be good care in behavioral health, but in primary care, it may just be because the clinicians preferred to do telephonic, what they were used to. So if you want to change behavior, you got to provide some accountability, and that means you got to do performance management. The areas where you can look for key performance metrics are around how are you moving the needle on your strategic objectives, what I mentioned earlier, the strategic alignment. So are we using telehealth to grow our operations? How do we measure that by now saying in the interview process that we are doing telehealth and we're committed to telehealth? Was it a deciding factor for somebody new to join us? So how do you measure that you are truly, that telehealth is helping you to achieve your strategic objectives? So just identify some metrics, and simple questions can answer that. From a clinical perspective, that is still a lot of area under research. We're just completing an outcomes measurement evaluation for integrated telebehavioral health. And we're seeing $1,000 cost reduction post-intervention in the care when pediatric patients were introduced to telebehavioral health. But it takes a lot of data churning to actually look at the outcomes. But there's more and more questions about whether telehealth is clinically as efficacious, and so that may be a little bit harder to get at. But we can look at simple things like annual wellness visits, because they could be done virtually as well, and we can see how they contribute to maybe moving our UDS quality measures forward. So there's some clinical aspects that can be measured. Financially, obviously, are we getting reimbursed? Are we getting claims denied, and for what reasons? Do we need to make changes to the process? And then technical. One thing I don't have in here, but the reason why you want to measure something is because you want to drive action. If you have a metric that never results in action, then you can stop measuring that. It may just be a vanity metric, but the measuring is a very expensive undertaking. People need to collect it, people need to analyze it, people need to prepare it for presentation, then people need to review the data, make sense of it, and then take a look at what to do with it. And so if you are collecting metrics that are not driving decision-making, then that data should not be collected. So you got to periodically go in and do some housekeeping and optimization to look at whether your metric collection system is working well. So here are 5 fundamental measures that a lot of organizations we work with are using. Starts with physician and clinician satisfaction and patient satisfaction. And what we do there is not an ongoing survey. We're doing what clinicians are doing. We're taking a pulse. So one organization, once a quarter, for 3 days, we're going to turn on the survey machine. We're going to ask every clinician to fill it out 5, 6, 10 times for their telehealth visits and document how was their experience. Just give us 5, 10 evaluations and good. We're also then asking the clinicians to ask the patients, hey, we're going to send you a link, or you should have a link in your received in your email while we were talking. Would be really great if you could just complete this online survey. We're really trying to optimize it. And you do it for a few days. You can also build it into your standard patient satisfaction surveys, but that usually doesn't yield a very low return rate. And so you just want to take the pulse occasionally and see how things are going. Is this statistically valid? Well, maybe not, but it gives you an insight and it drives actions. And actually the most important field on any survey is not the ranking, it's notes or comments. And that is such a rich field every time we get a surveys collection back, because that is where physicians are really telling us what's going on and what's not working. And then we can look at workflows, training, or technology optimization to do that. And now the data is driving actually the optimization, which is really where we want to be in that DMAIC cycle. Technical performance, we're just collecting simply the statistics of the help desk tickets related to telehealth. And our goal is to eventually that there'll be zero. But right now, the success metric, the goal is that every IT ticket will be handled within 24 hours, 24 business hours, within a business day. Right? That's our simple success metric for technical issues. Technical issues will come up. We just want to make sure that people report them and that they get addressed. And then financial performance, visit volume by modality, telephonic, video, or if you have asynchronous, maybe secure chat messages, and then also reimbursement by modality, or maybe reimbursement by code or by service line, so you can slice and dice it the way it makes sense for your organization. Simple set of metrics can be compiled and correlated monthly, takes a few hours once the systems are set up, but it provides great input to the steering team, to the governance team, or to the leadership team to then take actions on where to optimize and where to improve and where to do telehealth well. So, to turn metrics into action, you need to define who owns the data, who is ultimately responsible for making that decision. How do you define the metric? What does technical issues management look like? Okay, it's a health IT ticket that is related to telehealth. How often do you collect the data? How should it be reported? And then what are your targets for it, right? As I said, with the technology, our target is that the issues is being resolved within one business day. And then actually we found, okay, some issues cannot be resolved. Okay, within one business day, the loop was closed. The person who reported some action was taken and it was communicated back to the person that had this issue of what the resolution is or what the workaround is or how it's being addressed. And so that was the first very low maturity approach to managing that. And then what actions will be taken if the metric does not meet the target. That is actually a pretty clever idea that we've integrated into this approach, because you can define the actions before you even start collecting the data, because you can make a hypothetical assumption. Well, okay, if we want our satisfaction rating of clinicians to be 4.5 on a 5-point scale, and it's below that, what should we be doing? Well, okay, we should be doing a root cause analysis. We should be asking some questions. So that's the first step of action that needs to be taken. And that can be predefined so that the person collecting the data actually can go and initiate that action and then bring that analysis back to the team. So simple 4-step process for how to create your own KPIs, your own key performance indicators. And again, our table, which I'll not go through here in great detail, but if there's no KPIs identified, there's no awareness of telehealth performance. If there's poor data collection and also procedures, there's an inability to change, and so on and so forth. And in the right column on the tactics, you basically see what I just talked about. Identify your KPIs, set the policies and procedures, provide training to all people involved in it, provide some communication amongst the leadership, and then determine the appropriate data management software. So some really specific guidance that you can take offline and take a look at if you decide that performance management is something you want to sink your teeth into to optimize. With that, we're getting to the last section here. Trevor is going to be joining us again, and we'll be talking about optimization project management. So Trevor, you're on.
Thank you, Christian. And thank you for all the participants that have stayed with us for this entire presentation. As Christian mentioned, this will be our last section on the pillars. Simply put, project management and the project manager are the most important person on the team. And I might just be saying that because I am the project manager for our team at Ingenium. So all joking aside, project managers do provide great support to the entire organization. A couple of key responsibilities that project managers provide are support to the optimization, expansion, and growth of new services. Oftentimes, project managers work on very broad expectations. So working alongside different groups within the organization, trying to communicate with them and outline key deadlines and objectives are incredibly important. And collaboration is really a project manager's most important tool. Second, being ensuring that goals, objectives, and timelines are met. And this can be really challenging for project managers, especially when you're working with very creative individuals. You want to support them as they create wonderful products, but you also want to keep them on a specific timeline. You want to make sure that tasks are being accomplished and that these objectives are clearly defined. And that really moves to the third one I wanted to mention, is that clear guidelines on these objectives are being consistently implemented to the individuals on the team. It's really important, especially when you set timelines, to provide guidance on how to complete a task. Again, you're working with very creative people who want to provide the highest quality of work possible, but sometimes they may get distracted on working on other tasks. So really creating that guidance on a step-to-step basis of the bare minimum that they can accomplish is incredibly important for a project manager. And then finally, you need to create order within a complex work environment. This has been really common, especially after the pandemic, that you have a lot of organizations that move to a hybrid method. So you might have some people working at home, some people might be working in other states, other people might be working in person. So really making sure that that communication is transferred to all those individuals and that tasks are being accomplished is incredibly difficult at times, but is very important to the overall objective of completing new services for patients. Here on the next slide, we can look at what a project lifecycle looks like. Starting off with the initiation, which is the initial conversation that you have with leadership team. A new service is designed and or is talked about and needs a plan. Moving on to the next step, we have planning. So that's working with a diverse group of people to really set what the objectives might look like, what the end goal may look like. How can we better serve the patients that we provide care to? That being said, the next part is executing. We want to execute that initiative. So project managers really come to an importance during this section. We want to make sure objectives are met, goals, that things are moving smoothly throughout the entire implementation process. Next is controlling. This is really working with the performance metrics that Christian talked through, analyzing what is working, what is not working. Maybe we have to go back to the drawing board, to the planning section. But in this section, we can really understand the benefits our patients are receiving from new services and how we are competing with other organizations in our service area. And then finally, we have the closing, which really brings back to best practices. Having a debrief meeting on, like, this is how we've optimized it. We feel like we're at a good state. We can always be improving on things, but how can we improve implementation of new service lines moving forward? And it's really important to make sure that executive leadership, middle management, clinical staff, everyone is engaged during this entire project lifecycle. Finally, last slide here, we just, again, want to talk about the current state, the cost of that current state, and tactics on how to improve that. And simply, a lot of places do not have a designated project manager. This results with too many cooks in the kitchen, as we say. Too many people trying to do the work of a project manager with no assigned individual with that spot. So it's really important as a tactic to assign an individual, whether that be a new employee or someone on your existing team. Train that individual where they can clearly take over responsibilities for the deliverables and keep the project on track. The second one being no solid project management approach. This is really common with organizations. That means ineffective implementation, schedules, budgets are overdue. It really can impact the objectives and moving forward of a project. If you have a budget that is not meeting the standards that it should, you could easily run out of money and the end goal could not be achieved. So that really comes down to creating an approach. A a lot of people suggest the Project Management Institute, which has a project management professional certification. This really showcases how project management professionals can really implement that approach and improve on the goals set during the project lifecycle. Additionally, we have no established project management system. Again, very common. This can mean that you have delayed communication, missed tasks, things that are said in meeting are not written down. This can be a real problem for a diverse, complex team that might be through a hybrid version, virtual, in person. So really, we highly recommend utilizing a project management system such as Asana or Rike or Monday. These are all great tools. Our team uses Asana, and it's a great way to assign tasks to individuals, create agendas, make sure everyone's on task, because when you're dealing with more comprehensive projects that have many different elements to them, it's really important to ensure that individuals are meeting their expectations. And then last, but certainly not least, we want an effective communication tool. So lots of companies just do things by email, which can really be bothersome and really be annoying to a lot of people, especially if you're on multiple different chains, many different responses. It can be overwhelming at times. Oftentimes you can lose track of what's actually occurring. So a strategy we like to encourage people to use is some type of software or a mechanism that you can do many different things on. Being Microsoft Teams, many people have used Microsoft in the past, but MS Teams is great for having polling, having chat boxes, having different channels where you can create different teams on. And Slack is also a very great tool that our team utilizes as well. It helps communication immensely, where you can reply in threads, you can have prioritized tasks. It really keeps it easy for our team, especially when we're dealing with multiple different engagements at once. You can create different channels that really help organize that system for everyone. And that being said, I think we can move to the question and answer section. Christian?
Great, thank you very much. And yes, if actually Trevor and Sam can be here, stay on the screen for the Q&A. So what questions do you have? We covered a lot of ground here. We covered workflow strategy, project management, process management. I think the way that we intended you can use this material is that you can take a look at these tables that we've created in each and every section, and you can use it for your own gap analysis. You can see, well, how well are we doing against these things? Do we have these symptoms basically being present in our organization? And what would be most meaningful for us? So, and then, as I said, after the Q&A here, we'll also wrap it up with a few more slides before we send you over to almost the lunch session. So, are there questions from the audience? If so, please use the microphone to walk up to it. Would love to hear and engage a little bit dialogue. Maybe you can share what you have done for telehealth optimization. What resonated? What would you say? Yeah, this is the right way to do it. But this is one area where we can improve. So would love to hear from some here in the audience. Also, if you're virtually, please add your questions to the Q&A so we can display it here. Anybody can share something? Yes, thank you, wonderful.
Hi, thanks for this. That was a lot of great information. I think what we're struggling with the most is when we're launching or considering launching some kind of new modality, telemedicine modality, is gathering the specifications and lots of different stakeholders, lots of different expectations. And I guess I'm wondering, do you have some kind of template or guidelines for gathering all that? Like you specifically said, don't put the horse before the cart.
I know.
Cart before the horse.
I know. Don't buy the horse first.
Okay, there you go.
Right.
And I think we're struggling with that. So if you have any, deeper details you could give on that, would most appreciate it.
Yeah, well, I'm actually jumping into that stakeholder analysis over the next 3 days. We have 30 meetings in 2.5 days and 250 miles in Southern Virginia. And that's what we're doing. We're meeting with everybody and meeting with the clinicians, with the front office staff, and we're just having conversations about what you want to do. But to give you a specific example, like I mentioned that patient engagement tool, right? So patient engagement is about sending text messages, about scheduling and reminders. And so the first thing you want to figure out is, who are your stakeholders? Who are the people that have an interest, that have a stake in the outcome? So that's the first thing you want to do. The next thing is depending on, let's say, okay, we want to launch a telemedicine service with a school. So as a project, right? So what technology should we be using for that, right? We have the buy-in by everybody. Well, we got to figure out who is going to be providing services. Is it pediatrics? Is it primary care for the staff? Is it behavioral health? So that identifies first the stakeholders. And then, okay, a pediatrician, what do you want to do? Well, it's an elementary school, so we're going to have 80% ear infections. So we want to have an ability to actually diagnose ear infections and, or at least to decide whether they need to come in. So we need to have some technology that is able to look into the ear. Oh, would you want to save those images? Oh yeah, it would be great if we can save those in the EMR, right? And so you start uncovering, you start working them through the future happy day scenario of what it would look like to provide care at a distance in an ideal environment. And so the template is really, who are the stakeholders? What are the user needs? So that one slide for technology selection, that blue layer that I had there, that is your basic template. Who are the stakeholders? What are the user needs? What are your technical specifications? And then what are your characteristics you're looking for in a vendor? Depending on your willingness to take on risks with startups versus very established companies. So, but, and I'm happy to talk more about that if you have specific examples, just see me after the presentation. Any other comments from Sam or from Trevor on that? Sam, what would you say to the question?
Yeah, I would just add, in terms of also having a list of like nice to have, must have, nice to have. So for example, if I take that school-based clinic example, it might also be, it would be nice to be able to like text a parent, that this is going to happen, right? That this appointment's going to happen, but it's not a necessity. So that way you can really think all the things we'd like to have versus what we must have. And then that helps you also evaluate technologies on, well, they have 5 out of the 10 things we want, and this one only has 2 out of the 10 things. So I think that's a helpful way also.
Great, thank you. Any other questions or any other questions online? All right, then we'll move right along here, and I think we're doing good on time. Good time management towards 11:45 wrap up here, so you can stop by there before we go to the next session. All right, and then there's lunch at 1 p.m. So we walked you through here most of these elements in this framework, and again, we wanted to give you this as a roadmap that you can look at and check things off or circle things where you want to optimize your telehealth program, your telehealth services around those different areas that we've covered here. And then to lead telehealth optimization, one realization here really is that there are certain elements that warrant more attention first than others. And I would put them in this order, starting at the very bottom to lay the foundation, is you have to make sure that clinicians and patients and front office staff and everybody who's working on telehealth is okay with the technology. The solution may be training, the solution may be workflow, the solution may be replacing the technology. So you got to do that analysis first. And that's why kind of workflows and technology really lays the foundation for your program. You also want to make sure, especially since we're approaching the end of the PHE, that you have your core policies defined, not to just keep you out of jail, as we said earlier, but also to make sure that you're tracking licensure requirements and reimbursement requirements, and that you have somebody keeping an eye on the changing landscape. And so really that forms the foundation, the workflows, technology, and policies. That's the foundation of a good telehealth program. And then you can optimize and work on doing some training, website manners training, virtual exam training, scheduling training, optimizing. We listed this, Sam listed this slide with 7 different workflows that are involved with telehealth. It's not just a televisit, right? There's all these other peripheral workflows. Are they well defined? Are they well understood? Somebody asked a great question after the last presentation, saying, "Well, what do we do with no-shows? Right? What do we do with these exceptions? Or what do we do after we hang up with the patient? How do we schedule them for the next visit? How do we get them a refill? Right? All these processes that we have in an in-person environment need to now recreate it in a virtual environment." And then Sam mentioned here the telehealth tech checks. Especially if you're doing direct-to-consumer telehealth in any environment, whether it's urban or whether it's rural environment, you gotta make sure that somebody calls up the patient, ideally a few days before, and said, "Hey, Ms. Smith, you're scheduled here with Dr. Miller here next week. Just want to make sure it's your first time telehealth visit, everything is okay. So I'm going to send you a text link and click on that. Okay, now I can see you." Said, "Oh, I see you right in front of this bright window. So actually, and I see you holding your phone. If you could just put it on the table and make it stable, that would be really great. Or do you have a tablet we can use?" Right? So somebody's spending 5-10 minutes, because we do not want our clinicians to do technical troubleshooting on how to get on a Zoom call or how to connect to the sound or how to adjust the video. That is not their role, and that's definitely not their calling. Otherwise, they would have turned engineers and not clinicians. So we really want to make sure that we provide that service. And it's similar to a service we need to provide when we have a new patient, right? There's a whole enrollment process for a new patient. And if we have a new patient in a telehealth environment, we have that same process of having somebody call them up. And eventually, a lot of people will be ready, or some people may not be ready, and then they cannot be seen over telehealth. For me, 100% telehealth means that the patient wants it, the patient can do it technology-wise, and it's clinically appropriate. When those 3 criteria are met, we should be offering telehealth all the time, and if the patients want it, then it's appropriate. But it also, the 3rd criteria is very important, that it's clinically appropriate to do it. And then once you have these things in place, if you're looking for an order in which to tackle these things, then you can look at defining your telehealth strategy, making sure that you have leadership and governance involved, performance management, and also then one box here on top, the marketing piece, making sure that you let your patients know that it's there. Here's the example that we have with one organization we're working with. This is our Gantt chart, as it's known in project management. It just lists the different activities that are occurring in parallel or sequentially. And the red line indicates you are here, we are here. And this is how we kick things off. We are working a lot of things in parallel. We're collected some issues. We're established technical and operational support. We're working on clinician engagements. Those are the meetings I have in the next days, is where I'm going to meet with a lot of the clinicians one-on-one to ask about their opinion or their concerns about telehealth and telemedicine, just to see where they're at and what's needed. We're defining and documenting the workflows. We're optimizing the technology, expanding it. And so this is just, from a project management perspective, one example of how to manage all these different telehealth optimization projects and making sure they are on track. So it's now that planning, monitoring and controlling and execution cycle that we shared before. And just bring it all full circle here, starting and ending with a DMAIC cycle to really define what is the problem you're trying to solve, how would you measure success, how do you measure current performance, then analyzing of whether the performance is at the right level, and then improve the system, and then continue doing it by controlling. And with that, we thank you very much for attending the Matrix conference in person and also virtually. We'll do this again next year. The decision has already been made that we will stay hybrid for the foreseeable future. So we had a wonderful 1.0 beta, as Kathy said, and so maybe next time we have 2.0 alpha, I guess is the next version up before we release it. So thank you very much for great questions, and feel free to see us here afterwards. Have a great rest of your day and safe travels home. Thank you very much.